Health and social care research provides the evidence to improve treatments, care and services for patients, service users and the public. It transforms people's lives, promotes economic growth and advances science. Patient and public involvement in research is an active partnership between members of the public with lived experience and researchers in the research process. It's often described as doing research with or by people who use services rather than to, about, or for them. Involvement is different from taking part as a study participant, and public involvement is sometimes referred to as patient and public involvement, or PPI. Patients, service users and carers share their views, informed by their lived experience of their health condition or social care situation, to inform research priorities, direction and processes. They contribute what they know is likely to be relevant, important and acceptable to the people whom the research is for or about. These insights help researchers ensure that their research is meaningful, high quality and impactful. The term public includes patients, potential patients, carers, and people who use health and social care services, as well as people from specific communities and from organisations that represent people who use services. Also included are people with lived experience of one or more health conditions, whether they are current patients or not. It can also include members of the public with no specific lived experience, for instance, in research into disease prevention and into public health measures. PPI is not research about, on, or for the public. It does not include people who are research participants in a study, or members of the public who provide samples or data for studies, or situations where study findings are shared with the public by researchers. PPI envisages a relationship built throughout the lifespan of a research project between academics, clinicians, and PPI colleagues or embedded patient researchers, where PPIs meaningfully and actively collaborate in the governance, priority setting, and conduct of research, as well as in summarising, distributing, sharing, and applying its resulting knowledge. Accepted best practice is that PPIs are acknowledged and recognised for their time and contribution. The importance of involving PPI in the research process is understood by the research community, with funders requiring this in grant applications. It's also a key consideration in the regulatory and governance review of research studies. PPI improves the quality, efficiency, and relevance of research. It also serves the broader democratic principles of citizenship, accountability, and transparency, because most health and social care research is publicly funded. Meaningful PPI is important for undertaking good, safe, and ethical research, and should be a routine and normal component of the research process. PPI ensures that research studies are acceptable to participate in and suitable for specific patient communities. It ensures that the conduct of the study is scrutinised from a public perspective, and that negative or positive results are transparently disseminated, and ultimately contributes to informing improvements in care and lives. Diverse and inclusive PPI involvement brings valuable diverse perspectives to research, and involving people in research leads to outcomes that are more relevant to people's needs and concerns, are more robust and reliable, and are more likely to be used to improve health and social care services. There are many types of public involvement activities, and PPI can be involved in all stages of the research cycle. There's no one-size-fits-all approach to public involvement, and this infographic depicts the many opportunities for PPI to participate in research and development activities, from concept right through to dissemination of research findings. PPIs can also participate in one-off focused and time-limited research development activities, such as participating in focus groups or presenting at conferences, representing an organisation or research team, and talking about the experience of being involved as a PPI in a research study. So how can you get involved as a PPI? Reach out to your disease-specific patient organisation and encourage them to become active in the research field. Connect directly with the research community and see if there are any established networks in your disease area, such as the INHA Kids Network and Infant and Child Brain Consortium of Ireland. Connect with the PPI Ignite Network, who work with several universities in Ireland here, Become a member of IPOSI or HRCI, who connect patients with researchers. And on the European platform, connect and join the EUPATI community of patient experts. Identify your training requirements and work with your research colleagues who will often facilitate PPI training needs. Build your knowledge base by participating in the IPOSI Patient Education Programme or the EUPATI Patient Expert Fellowship. Start small. Don't jump in at the deep end by starting off your PPI journey as a core collaborator on a study. Ease yourself gently into the area. Ask questions when you're presented with material that you may not understand. Remind your research team that they should use plain or lay language when working with you, and over time you will build a strong knowledge base. It's important that PPIs have clear terms of reference when participating in studies, so that everyone is aware of the expectations and goals of the PPI within the study. Earlier, I referred to the need to value PPI contributions. PPI should encourage researchers to build a PPI budget into their grant applications and ensure that they are adequately compensated for their contribution. Self-care is paramount. Many PPIs tend to be patients with ongoing health challenges, and it's important to ensure that you don't overcommit yourself at the cost to your health, and clear and open dialogue with the research team is a must. It's important that all studies measure PPI to facilitate better PPI engagement in the future. And finally, a PPI feedback mechanism ought to be in place to facilitate constructive feedback from the PPI to the research team. My final slide provides a short, but by no means exhaustive list of PPI resources that will help you on your PPI journey. Thank you.